healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Leaders in Healthcare. I'm Dr. Jordan Vollrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about all things healthcare. Join us as we speak to innovators, industry leaders, and the people working to drive the healthcare system forward. Today we're talking to Jennifer Eyford. She's the Director of Mental Health, Addictions, and Outreach at the Alex Community Health Centre in Calgary, Alberta. Jennifer brings over 20 years of leadership experience in mental health and addiction, and her background in clinical program development has been instrumental in launching successful initiatives such as the Alex Rapid Access Addiction Medicine Clinic. In addition to her leadership role, Jennifer remains dedicated to frontline work, supporting programs like the Supervised Consumption Site and the Opioid Dependency Program on weekends. Jennifer also serves as a council member for the College of Registered Nurses of Alberta, where she's passionate about advancing the nursing profession in the province. Currently pursuing her doctorate of nursing degree at the University of Calgary, Jennifer is committed to deepening her understanding and impact in the field of addiction. Beyond her professional commitments, Jennifer loves ultramarathon running and is a voracious reader. I think we see eye to eye on a lot of things. I'm very involved in the addiction and mental health space myself, and just finished my first marathon actually in December.
Congratulations. Fabulous. Which one was that?
Honolulu. It was hot. I think the sea level denser air adds a few horsepower, so it actually went pretty well.
Congratulations. Big achievement.
Yeah, thank you. Well, and so tell us a little bit more about the Alex Community Health Foundation. You guys have become rather legendary around here in Alberta as sort of kind of the shining star in terms of inner city clinics and mental health and addiction. Tell everyone a little bit more about how you guys came to be and sort of the bigger picture.
Absolutely. And I'm so encouraged that you say that, Dr. Jordan, because I often feel when I tell people where I work, they don't know what the Alex Community Health Center is. So thank you for giving us the space to shine some light on the work that we do. We have been in existence for over 50 years, started as a really small community health center model in Inglewood in Calgary, and grew from there. We added lots and lots of different programs along the way, started as a clinic, added housing, added a mobile service, added a seniors clinic, youth clinic, food center, you name it. What's really special about us, or unique, I should say, is that we are a member of the Canadian Association of Community Health Centres, which is actually a model of care. And some folks don't know this, but it really views health as a holistic undertaking, that we are not just the broken ankle, or we're not just the headache, but we are complete beings that have needs in all different areas. So the community health center model really takes this into account, and our programs reflect that. Obviously, primary care is health. We all know this, and from time to time we access it. But food is health, and housing is health, and connection is health, and learning skills is health, and connecting with your cultural background is health. So that's what we believe in, and I think live as well. And we are a mid-sized organization. We have, I think, in between 350 and 400 staff, and a robust budget, and a couple of programs that are not located in our main building. For example, our food center on 17th Avenue in Forest Lawn. And but what we always hope, no matter what building you enter, is that you're being greeted with a warm smile, that you have the feeling that you belong, and that you get the care that you need, and sometimes you even get the care that you didn't know you need. So that is kind of one of my new ways of thinking about health. It's always leveraging the window of opportunity, but sometimes you just create that window of opportunity. And I think that's where a lot of opportunity lies, working with folks that have barriers to care and that are vulnerable and sometimes deal with a whole host of issues. So I could go on and on and on, as you can tell, so I'll just stop here and take a breath, but that's maybe a good introduction to who we are as the Alex.
Well, I understand that the community health center model is a lot more popular out east and in Ontario versus here in Alberta. It's actually quite limited and there's only very few of them. How did you guys get started? It's amazing that you've grown to such magnitude at this point. I mean, your head count rivals that of, I'm sure, many of the hospitals here in Alberta. So that's obviously something is going well. How did you guys get the origin?
Yeah. We started in 1973, and just really built from there. And it's really interesting that you highlight this because we only have two other community health centers in Alberta. We have CUPS downtown, I think quite well known to folks that frequent the Beltline. Wonderful partner organization. We work very closely with them, and then we have Radius, formerly known as Boy Macaulay Community Health Center in Edmonton. And they're both a little bit smaller than the Alex, but I think there is so much room in the space of providing health differently. And I think that's what we're seeing a little bit in the overall landscape, trying to provide health a little bit differently. So my hopes are high that this model is really something that is of interest to senior decision makers, and we can see more community health centers here in Alberta.
Fingers crossed. I hope so. This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today. So, a big part of what you guys do revolves around addictions, mental health. I was wondering if you could highlight perhaps some of the stories and the resilience of people and some of your patients that have come through.
Yeah. I'm really glad that you're asking for stories because funders always ask us about data and whether we spend money in a fiscally responsible way, and I like that. I'm a data nerd, but I believe stories support this data, and then in turn the data support the stories. So yeah, we have lots of stories. And asking about mental health and addiction, yes, we have some programs that are dedicated just to mental health and addiction. But how we view addiction mental health is that most likely every single person accessing services has a need in that space of mental health and addiction. So what we also try is not just have dedicated services, but also equipped to offer mental health and addiction services in programs that are not specifically dedicated to mental health and addiction. Speaking of that, I've been with the Alex for over 14 years, and I always say I grew up clinically at the Alex and started in our housing programs. And I was an outreach nurse in our Pathways to Housing program, and it was housing, but the amount of mental health and addiction support that our clients need is certainly undeniable. And maybe one of the stories that I think about to this day is a client that we'll just call Gordon. And Gordon had a really tough life, never really been housed, always lived in cars, homeless at 14, years and years of incarceration. So when he came to us and we provided him with a really beautiful, spacious one bedroom, he was utterly overwhelmed. And he was an exceptional housekeeper and a great host. So having visits with him and discussing his mental health and addiction needs was always a pleasure. But he made a comment that he had just gotten home. And I said, "Where did you come from? It's early in the morning." And he explained to me that every night he would pack up his sleeping bag, he would lock his place carefully, and he would sleep in an alleyway just a few streets down because sleeping in a bed was so deeply uncomfortable for him. And I did not know what to say to him, but eventually we unpacked it and we discussed how skills can be sometimes lost, but then also relearned. And we addressed his trauma, and we worked with him because he really had the goal to fully appreciate and enjoy his apartment. And there was a transition phase where he slept on the balcony, and he would do that in -30 at night, in the winter as well. But eventually he would sleep in his own bed. And I think the first time he told me that, I may have shed a little tear, because that was not just therapeutic success, but human spirit success. And I think that's why we all come to work in the morning, is to see that human spirit prevail and shine. So that's one of the stories.
I mean, that's amazing just how deep that instinct goes, I guess, and how challenging it can be to change those patterns and those habits and those behaviors. I mean, it seems like such a nonchalant decision to a person of like, okay, well, you've got the bed option, but just coming in from the outside and it not feeling natural.
Yeah, probably unbelievable to folks very much like myself, being deeply privileged with resources and ability to look after myself. And yeah, absolutely, that was a learning opportunity for sure, to not ever make assumptions and to really support the folks in their needs, and appreciate where they're at, and how they can move the needle for themselves.
For a patient like that, like what changes, I guess, or the why now for seeking help and following up with, for example, the Alex Clinic and getting help?
If I remember correctly, in his case, he had been referred by the hospital. He had a lengthy hospital stay, would have once again faced homelessness. He was oscillating between homelessness and incarceration, while also struggling with a significant mental illness. So the ability to refer to the Pathways to Housing program really broke that cycle. And we have psychiatrists, we have nurses and doctors and social workers and peer support. So a real wraparound kind of team for the clients that have been struggling with homelessness, mental illness, often addiction, often chronic physical ailment. And yeah, that referral to us, I'm making up, broke that cycle for him. And he had been able to preserve a lot of his skills. He was an immaculate housekeeper, and really grateful, except that he was unable to sleep in his bed. And I think he was really able to leverage a lot of that support that we had on offer for him, and really enjoy quite a few years of stability until he unfortunately passed away of a massive heart attack, which is a fairly common way to go for folks that have been living what we call rough. So sleeping outside for many years, it takes a toll. And often substances such as alcohol are quite toxic for the cardiac muscle. So unfortunately, we do lose folks through heart attacks way too early, and sometimes other reasons as well. But that client will always, have a tiny little corner of my heart for sure, because he was an example of that human spirit that just prevailed. And how I always reframe losing a client is that towards the end of their life, even though maybe years were cut short, they were truly honored in their wishes. They got exceptional care. They were really professionally loved, and they weren't missing or wanting anything. And we were able to provide that. So no more Jane or John Doe's. I've been to funerals where 3 people showed up. When our folks, sometimes sadly pass on, it's a whole community that comes together. And I think there's something to be said about that.
Well, I can imagine working in such a setting, like the positive and the stories of resilience and triumph and overcoming the odds, are probably balanced out quite a fair bit by, a lot of the sadness and the bad outcomes. Like, is there a certain type of personality that winds up working in a clinic like the Alex, who's able to kind of compartmentalize those and like, not let it go home with them and impact their own mental health?
I think that is the big secret working in this space, that you do need to care. I think everyone coming to work in the morning here at the Alex does so because they care so deeply. It's one of our values. But there's also a little bit of a skill, if you want to call it that, to be able to have enough healthy distance to go home and also immerse yourself in a life away from work. And that might be a little bit of practice or a little bit of reflecting. but it's incredibly important to be full on, leaning in, showing up for our people while not taking the stories home, worrying, not being able to sleep because you know someone is struggling. So I think some people decide to do this for a few years and move on. Some people, like myself, perhaps have figured it out somehow. I can't tell you what the secret recipe is, but there are some folks that have been around just because it fills our cup, and we are able to walk beside people without trying to carry the people, and allowing folks to make their own decision without feeling personally perhaps impacted. Or I think dignity of risk is a big piece as well, allowing people to perhaps make choices that we know are not perhaps leading to the best outcomes, but having that appreciation and respect for the other person. And in all those things I'm saying, somewhere in there, you're able to come and lean full in, and then also leave at night and be there for your family and do completely different things and not think about work. And I think that's how you can stay in this field for a long time. And then there's also no harm, no foul leaving and doing other things. I think it's important to be fulfilled, spending so much time at work, more than we have time for hobbies and things outside our work. So it needs to be a good fit. And as long as it's a good fit, I'll be here. And I know my coworkers are. And one day when there are different things for me to bring my gifts to, then I will do that. So
Yeah, I guess not going the other way too and getting sort of jaded and disconnected.
absolutely. I think that can be quite harmful to oneself and the patients you work with if you're crossing over into the realm of cynicism and negativity in a way. I don't see that reflected at the Alex. I've seen it in other healthcare environments that I have worked in, and it's terrible for the person. I'm making up deeply unhealthy, and it's terrible for the people around it. So what I really hope and I truly believe we have here at the Alex is that we have a work environment where I always call it an environment or a culture of feedback, where someone can say, "Hey, Jen, you are off today. What's happening?" I'm like, "Thanks for letting me know. I must be, I must not have gotten my 7 hours of beauty rest. So thanks for." I'll be more mindful for the rest of the day, because it's not okay for me not to show up whole. Also appreciating that, we're also humans, and we're not always 100%, but I'm trusting my team to let me know if I'm not, because then I can also make adjustments and not cross over into this unhealthy space that I think it's time to move on. If you find yourself in that corner of the room quite frequently, and a vacation or some time away is not doing it for you, maybe it's time to find a new pasture for you to hang out. So
I imagine the staff and the team and your colleagues, you guys are probably very close, tight-knit group at that point, like working in an environment that's going to be a little more stressful than, I don't know, is that true, like versus nursing in a different type of situation or another ward in the hospital or another clinic? Is it more stressful?
you might ask every single staff here and you might get a different answer. I find it, I would flip it on its head and I say I feel deeply engaged. I do need to feel that, they call it eustress and de-stress. I need to feel some of that eustress, because that keeps me excited about what I'm doing. I would not be a good person working in a job that's not fast paced or is not giving me kind of this, engagement. But yes, there are also sometimes big challenges to overcome. And but I think it is truly in the eye of the beholder. Is that something that you take as negative and you're, grumpy about, or is that something where you can step up, maybe gain some skills, add that to your toolbox? Or, but what I think is behind your question is, how do you deal with a work environment that's pretty dynamic, which the Alex is dynamic on any old day. And that is absolutely relationships. We are very committed to one another. We care for one another. Leadership is very committed to create an overall culture where you can be heard and where you can be vulnerable, where you can trust. And that doesn't mean we're all best friends and hang out on a Saturday night. I don't think that that's necessary, or perhaps even, that's smart to do all the time. But when we're at work, we're a team, and we can turn to one another. So stressful or not, if you're being supported and backed by a team, the rest kind of falls into place and can just be either normalized or reframed. And we never have to do it alone. This job is way too big. Any part of this job is way too big to do alone. So I think there's a direction set by senior leadership and just trickles down. And we are there for our team as much as I know that my leaders are there for me. And I think that shows.
Could you tell me a little bit more about the resources and sort of the intake process for when you guys have a new client or a new referral that comes through? What does that onboarding process actually look like?
Yeah. And you're specifically thinking about clients and patients and access our services?
Yeah, like from the lens of a doctor who's, got a patient who would be suitable for, at least one of the services. Like, what's kind of on that menu, or how do you guys go about connecting the patients to the correct resources and doing that initial assessment? Or who do you want to see more kind of referrals? What types of people?
Since our offering of services is so diverse, also accessing us is quite diverse. Our most low barrier way of accessing us, it's literally to show up. And we have a wonderful community kitchen, and we have meals, not every day, but several times a week. We have meals. The community kitchen here is packed, and there's staff that engages and strikes up a conversation. So that's one way to get support and that sense of connection. You show up and you might see a flyer. Oh, they have a group this afternoon. Maybe I stick around after lunch. So very low barrier, because we know a lot of our community members need that. If it's something a little bit more formalized, like a medical program, always keeping our clients at the center of what we do. For example, our rapid access addiction medicine clinic has walk-in hours. So in between 9 and 11, folks, once again, can just show up and have an intake with a nurse. And if they're interested in what we have to offer, we make a doctor's appointment that then meets with the patient, does their own intake, comes up with a treatment plan, and officially accepts care. For our housing is at premium here in Calgary. We are funded by the Calgary Homeless Foundation, so there's a little bit more of a structured process, and folks get in through an integrated, coordinated approach where all this homeless serving organizations come together and discuss their availability of spots. So it really, really depends. My personal preference is always really low barrier, because I know that works. But we also have programs where it's a little bit more process oriented to access us. But drop in, showing up, walk in, that's what we try to embed as much as possible. Also fully appreciating medical care. It's also something that is a commodity that we don't have unlimited amounts of. So yeah, I think we're striking a good balance between being more formalized while also really being easy to access.
Well, the ease of access definitely is key, and it's like a huge challenge in the Canadian healthcare system, and definitely one of the buzzwords going around right now is just, can you get access to services? So that's amazing.
Yeah. I can share my personal leaning towards access, and that is truly not becoming low barrier, but trying as an organization to find ways to, and I don't think we will ever be there, but working towards a zero barrier approach. How can we remove the last little bit of barrier that prevents our folks from showing up here. If you think of walk-in hours, for example, people might think that's great. That's really low barrier access, having walking hours. You don't even need an appointment. You just show up. If I'm a single parent, I live in the south of Calgary, I have 3 children and it's minus 30. I'm sorry, coming here for walk-in hours is high barriers. So what can we do to remove the barriers that exist? And for me, it's bringing the services to where the people are. And we have our street team, folks of dedicated peer support workers and social workers that engage folks that are street connected, check on them, offer whether it's a snack or a conversation. And some people might think this is really just a fun activity, but how I view this work is engaging folks in healthcare that have not been engaged in healthcare for many, many years, because we as a collective, as a healthcare system have not done a great job serving our most vulnerable folks. And I think we have a little bit of catch up to do to rebuild some of that trust. And for example, the street team absolutely removing any and all barriers, coming to you, maybe having a rest on a bench, making sure you're okay, asking what your needs might be. And if it's, I have no needs, but thanks for the treat, that's wonderful. But maybe you share with us what your needs are, and we will provide case management to you and make sure that you get connected, whether it's being provided a ride or system navigation. And we were also the first organization here in Alberta that put a mobile health bus on the road in 2001. And we have a fleet of multiple buses now, a dental health bus, a mobile care clinic, a youth health clinic, community health bus, and they're fully equipped doctor's offices on wheels. And we show up at places where people don't necessarily expect care, and we provide healthcare and engagement and peer support and trauma-informed care and all of the above. And people don't have to access us. They don't even need to know what they need. We figure that out with them. And to me, that is, I'm not saying we're fully there yet, but that is inching towards providing zero barrier care. And I'm kind of proud of that, because I think that's what, in my opinion, the future of healthcare should be, bringing the care to the people. And I was talking about, not just leveraging a window of opportunity, but creating a window of opportunity. And it's all part of what I have in my head, the future of healthcare should look like.
Well, it's incredible to see the proactive outreach. Like, I wish that was more readily accessible across populations. Like, there's just so many people that are not connected with the medical system, kind of regardless of how much they need it. And that trust, like you mentioned, especially recently with the pandemic and, a lot of the government changes and restrictions, that trust in the doctors by proxy and by the medical teams has definitely been, I would say it's taken a hit. And the fact that you guys have these street teams and the engagement and are able to go out there and actually meet people where they're at, I think that does wonders for building those relationships.
I can't agree more. I think it checks all the boxes. It's trauma informed. That's what funders are also interested in. It's also cost effective. If we can prevent, folks accessing the emergency or acute care system, which no one really wants to access those systems. I mean, we know it's a win already. It's showing up at an emergency room is the most expensive way to receive care. Not always the best, because it's often what happened, in the days leading up to me showing up at the emergency room that may have needed intervention. So an emergency, whether it's a mental health crisis, addiction, or a physical crisis, could have been prevented. And I think there's lots of work left, but certainly the Alex is doing what they can to work against that. If we don't have proper services in the community, we will see more people showing up in the hospital, and we all know what the situation is like in the hospital. Having worked in one, I know it's tough, and there's not enough staff, and there's not enough not enough resources, and let's not be there if we don't absolutely have to be. So yeah, I think there is some innovation that still can be leveraged. And if we can act as a little bit of a role model, happily to talk to anyone who's willing to listen to us. But yeah, I truly believe that's how to do healthcare in a human-centered way that is also cost-effective, and I think that makes everyone happy.
You mentioned, the role of trauma-informed care in the context of addiction, substance use. What does that look like? What does trauma-informed care actually entail?
Mm-hmm. Well, we all know how trauma and addiction. Someone said to me once, "Walk hand in hand." That is actually a really good way to look at it. How I talk about trauma and addiction is trauma is the underbelly of addiction, and the correlation between the two is quite remarkable. And unfortunately, the research that comes out in the field of epigenetics is absolutely fascinating, but also shocking how much of an impact trauma has on us, especially if it happens early. I think most folks are familiar with the ACE studies that was done by Kaiser Permanente in the 90s, where they compared early childhood trauma, such as having parental illness or incarceration, food scarcity, and things like that, and followed them for a really long time and looked at their health outcomes. And I want for folks with nitty gritty details on that, but the link just can't be denied how close it is. So all to say that we at the Alex just make the assumption that people have experienced some difficult things, and we tailor our care in accordance to that. And I'm not sure who I can give this or can attribute this quote to, but it's all about not what's the matter with you, but what matters to you, and just acknowledging that maybe your journey up to today, meeting us, has been a difficult one, and how can we support you and lighten the load. And trauma-informed care is all about safety, patient autonomy, control, and choice have often been taken away when people have experienced trauma. And we try to show professionals that actually can be trustworthy and can be supportive in a way that really fits the needs of the folks that access us. And if the world was running according to me, I mean, there's so much that can be done in that area. There's even an area called trauma-informed design or something like that. Like you can even build your space in a way that calms people down. Obviously, being a non-for-profit organization, there are limits to what we can do, but we have done some things with colors. And but at the end of the day, I think it's really the people that greet you and that work with you that provide that trauma-informed care. And but yeah, it's something that is not always connected to healthcare. I think folks in the acute care system are incredibly busy. There are different specialists working with you. You're being handed off, and we get the privilege to working longer with our clients, so we can really build relationships, and that's truly what trauma-informed care is. We have a relationship that you can trust, and I can be helpful to you and support you in your goals, which makes you find, coming back here is a worthwhile activity to you. So, and we get the chance to prove that over and over and over again. And often in healthcare, where time is truly money, folks don't get to prove that to their clients, but we keep showing up day after day, and people gravitate towards that.
How does that trauma-informed approach, I guess, change those initial conversations? How does that actually change those first contact points when you're first talking with a potential patient?
Maybe there is a beautiful example that I can share. We had a person, he wasn't known to me. Maybe he was known to other people in the clinic. But he came in like a whirlwind, very upset, hooting and hollering. Perhaps someone may have considered it threatening behavior. And one of my colleagues just simply said, wow, it sounds like you had a really rough day. And you could just see it in that client's face. They were just, and with a much more gentle voice, they said, yes, I did. And it gives me goosebumps to this day. It wasn't like, sometimes these signs you see, abuse will not be tolerated, where I'm thinking, if I'm really upset about something and I make my feelings known in a way that is maybe difficult for others to tolerate because my coping skills aren't great, and then someone points to that sign and says abuse will not be tolerated, is that helpful to me? Will I say, oh, thanks so much, I'll calm down then? No, it's not. We need to take the meeting people where they're at really seriously and model that. So my coworker is saying, it sounds like you had a really difficult, a really rough day, spoke to that emotional need that the client presented with, but couldn't articulate. They couldn't say, I'm hurting, whether it's, emotional hurt or physical hurt. They couldn't say that for a variety of reasons I'm making up. But being greeted with understanding and validation where the person was in terms of their emotional state, holy cow, that was incredibly powerful. And the person calmed right down. And then my coworker said, hey, what about a cup of coffee and a sandwich? And you can tell me what happened today. Man, 10 out of 10 right there. So that's what trauma-informed care is, where we have to sometimes step out of ourselves a little bit. And I absolutely want to include myself. I'm a Western trained medical nurse, and I work in healthcare and in frontline care on the weekends, and people being very demanding or being, maybe a little bit more vocal about their needs because their needs have never been met. And I can relate to folks that have that reflex to put people in their place, because I've had to sometimes, take that second to just, check in with myself, because it's very tempting to say, you need to not yell at me. And when you calm down, you can tell me what you need. And, oh, by the way, you're so late for your appointment and we're closed now. And all these barriers that I easily put up for folks that already have plenty of barriers. So I think it's a real skill. It's a real talent. And, it's something that is so deeply therapeutic. You don't need letters behind your name. You don't need have read the latest clinical research or anything, but showing up fully human and appreciating the person walking through the doors as fully human, and just two humans connecting in that space is powerful and deeply therapeutic. And I think we don't take advantage of that often enough. Just healthy human interaction without it even calling it treatment is treatment. So yeah, so that is what trauma-informed care is.
The
To me,
compassion and the empathy, I guess, for your fellow human really changes the trajectory of that encounter. It's an interesting premise just in general, right? It's like in healthcare, the client versus the person paying is completely disconnected, versus you look at like a retail environment, right? It's completely opposite. The customer is always right. They're a lot more tolerant of behaviors and tones of voice. And, in healthcare, we've gotten a little bit kind of high and mighty here on our pedestals of, well, okay, there's a shortage of us and a surplus of you. And that tolerance has just, you see these like zero tolerance policies popping up all over the place. And not to say that, being verbally abusive to your healthcare provider is right. Yeah. Obviously, that's not the case. Yeah. But, often these are a little bit more complex or sophisticated situations.
Absolutely. And my heart goes out to my peers working in the hospital, often under really difficult circumstances, being short-staffed, asking to work double shifts, having too great of a patient load. I think it's really hard to be therapeutic at all times when you're just stretched to the limit. And I'm looking forward to seeing some improvements in that area. So we all entered this field for a reason, and to just never ever forget why we chose this path, so we can just show up as humans that have the capacity to care for others and to heal just by our presence, just by validating an experience, just by listening, just by saying, and often without words, I see you and I hear you. That alone is deeply therapeutic. And that's my hope for the future anyways, that we can all do that.
The compassion, exactly.
Mm.
Well, when it comes to substance use in general, are there any like programs under your umbrella that have been, I guess, like the shining stars or the biggest hits, or they had some of the highest success rates? I guess, like, how do you chop that one up in terms of, your KPIs when you're talking to funding bodies and things like that? Like, what are those kind of highlights in the clinic that you like to talk about or show off?
Mm-hmm. I'm incredibly proud of our RAM clinic, the Rapid Access Addiction Medicine Clinic, which is not a model that we came up with. I wish it would have been my idea, but it's our addiction medicine colleagues out in Ontario that came up with the model. Once again, low barrier is what shifts the needle. So it is a model that connects people that are ready to seek treatment for their problematic substance use, connect them immediately with pharmacotherapy, so medication for addiction, counseling, peer support, skill development, groups to stabilize folks, to give them a taste what life could be like without having an addiction that, as we all know, can take over every single aspect of your life. And once folks are stabilized, they can be discharged to less intensive services. But it's this initial engagement and care, having walk-in hours, and being able to receive clients every single day, having really knowledgeable staff, including the providers who provide the addiction medicine. And once people feel better physically, all of a sudden, they can engage in skill development. They can start thinking about, oh, maybe I will give treatment a try, or oh, maybe, now that I'm, feeling better about myself, I can go back to work, connect with my family. But that is something that I feel has made a real big impact. And once again, is a model that is not really utilized. We have a partner clinic with Alberta Health Services. But once again, Ontario is beating us by a long shot. Lots of RAM clinics in Ontario, and then it truly trickles out. And we have 2 here in Calgary, and leveraging the window of opportunity. People might get tired of me saying that, but that's where the magic sits. You are ready to accept care, and I have the care for you. Bingo. So that is something that I'm really proud of, because I feel we have changed lives by offering an alternative to feeling unwell, having overdoses, being disconnected from friends and family. Gabor Mate says it so beautifully. The opposite of addiction is not sobriety, it's connection. So once again, the community health center model lends itself beautifully to that connecting piece and being integrated. So our RAM clinic, it's not a standalone clinic somewhere at a street corner. It's fully embedded into our community health center, and people will smell the good food and see the smiling faces coming to our RAM clinic, and most likely they will sneak a cookie or strike up a conversation, building community, connecting to others. So even if they end up not engaging much for that moment, they felt that they were in the right place and they felt connected. And then lots of people do engage and take advantage of our programs. So all to say, our programs have impact, whether it's addiction or not, because it's that holistic approach to care, which goes back to the model we use. So it's not just the one thing. It's not just the addiction that we have perhaps Suboxone and a group for, but it's also, you had a really nice conversation with the peer support worker. So now you want to come back tomorrow and finish up your conversation because you had to go, or you learned about this group or this activity that we have next week. And there you are. You have a community that you now feel you belong to. And that in itself is health and therapeutic. And yeah. So that's probably how I view it.
Well, it's fascinating just how important, I guess, the window in time, that opportunity and that moment for engagement is, right? It's something that I never really consider. When I see a patient as an outpatient and they've been booked in and they're, I don't know, let's do it on the wait list for 2 months before they actually get in to see me. I'm like completely removed from that temporal component of just, okay,
Yeah.
there was this brief window of sobriety or of, feeling low or of feeling high and good. And like, where do you actually get that moment of connection from? And how interesting that is, that it can be, even the simplest thing, it seems like, that actually creates that connection between the healthcare system. And I've always thought of it as more of like intrinsic with the patient of, are you ready for change? Are you pre-contemplative or contemplative? Where do you fall on the spectrum versus sort of just that opportunity itself?
Yeah, absolutely. And if you look at different statistics, often, especially in the area of addiction, folks on wait list are never receiving the care they need, unfortunately, in the context of a contaminated street supplies, because have passed on. But even if they're still around, that window of opportunity has closed, and we missed an opportunity to provide care. And it also takes a really high level of organization and foresight to be on a wait list. Your need isn't met in the meantime, and you need to cope and keep that in your calendar. And I think often for our folks that are struggling with very basic needs, namely housing or food or lots of other basic needs, we're really setting them up for failure, giving them an appointment time in I just received a specialist appointment from my GP to see a physician in November. I probably have the level of organization to show up there. It's okay that I'm not seeing that person until November. It's not a really acute need. And I would be able to take myself there and take time off from work and all of the above. But I also deal with way fewer obstacles than the folks we serve. So having that service on offer when the person needs it. I can't really speak to any sound research in that area, but a spidey sense inside me just tells me that is also not just best for the client, but once again, there is probably a bigger impact, including cost, to do it that way than managing a really vast wait list where people just not showing up and you're missing out on these appointments just because people weren't able to wait that long. So I think there is a lot of process improvement and healthcare system improvement possible to just make that a system that works for everyone. I think we are wasteful in a way that we have a difficult to navigate system that at the end of the day is still costing a lot of money but not meeting need. And I'm a frugal German, so that always irks me when I see waste. And when I see waste that's not really benefiting anyone, and there is so much need that's, doubly painful.
Where would you like to see things progress in terms of the healthcare system? If you could wave your magic wand and add more funding here, more personnel there, more, I don't know, systems change or process redesign, what could that look like?
If I was the queen of everything, I would build a healthcare system that addresses every and all aspects of health. And obviously here at the Alex, we focus on vulnerable community members that have barriers to care. But I'm making up holistic care would benefit everyone, no matter what their background is or walk of life. And I would maybe I would just start with one organization or one service and do a little pilot and some PDSA cycles before I would scale up. But what I envision is a program that actually checks all the boxes. So if we're going very basic, you're lacking housing. So a program that addresses your housing needs in a way that meets your needs. So then there's income. You need to pay for housing. So we support you with that. You might have mental health concerns. So access to a psychiatrist, which is even hard for you and me to access a psychiatrist, long wait list to be able to
They
speak
are
to a
rare.
specialist. Absolutely. So I would have access to a psychiatrist because, all of a sudden, because you have housing, because your mental health concerns are looked after, your substance use goes down just automatically. That is actually well supported by research. Then there is that element of connection. So I would have community meals that we all know food is health, and food brings people together, and also food can heal lots of different ailments or prevent the occurrence of disease. So having community meals and having a meaningful activity during the day, whether it's educational work or volunteering. And I would design a program where no aspect of truly ourselves as human being is every of these elements is looked after, because that is something that I often feel is missing with the addiction conversation. We are at a space where we say, okay, so we understand best practices often, especially with opioid use disorder, to have pharmacotherapy on board. But do we talk about trauma often enough? That needs to be addressed, and it needs to be especially addressed once we stabilize patients, because there's a reason why folks started in the first place. So if we stabilize them in the area of addiction, we certainly have the potential for trauma to pop up. And how are we supporting our folks if that's the case? And what we do here at the Alex is that we send our mental health clinicians to special training. It's called accelerated resolution therapy, and there's pretty robust evidence that even a few sessions can help people make feel better that have experienced trauma. And I remember one client saying to me, after 2 sessions, I have never felt this good since I've become an adult. Holy cow, that's something that I want to do more of, because that is not a really, that is high yield with very low involvement on our part. Yes, we're sending our clinicians for training, but in the big scheme of things, it doesn't cost a lot, or it's not this magic pill, or you need to come to therapy for years and years on end. This is very good bang for your buck. So addressing trauma, and being able to address all elements of health to really move the needle. I'm making up with this model, we would have good, we would see a decrease in, if we were able to do this on a larger scale, a decrease in homelessness, because people would be able to stay housed, because we're not just giving them a house and leaving them alone, but we're supporting them in all other areas. Addiction, we're treating the addiction, we're treating the mental health components. When I still worked in the housing programs, often people got into trouble because they were so lonely, bored, isolated, depressed, that they invited their street family over. Guess what happens? That housing situation became very challenging, and often folks lost their housing. So let's check all the boxes, and I'm making up, we would see great impact in all sorts of areas, including hospitalizations, including mortality, and including, lots of other areas. And then at the end of the day, what about quality of life? If people feel really happy and are able to live to their full capacity, which often they can't if trauma, homelessness, addiction, all of the above is in the way, I think that's good for everyone. If we have community members that can lean into life and have good quality of life, they also start giving back, and they're the next one to volunteer. And I think that creates a whole bunch of positive energy. And I don't want to become esoteric here, but as much positive energy as we can, release to the universe, the better. That's really my opinion. So
Well, I like that view on it, right? Going upstream and looking at a lot of those, the social determinants of health and how did we get here in the first place when it comes to the individual? What kind of things can be done to, reduce relapsing and some of those underlying causes for homelessness, those underlying causes for addiction, or, like you mentioned, the trauma and all these different mental health pieces. I think that's a beautiful way to look at it.
Yeah.
What do you guys have coming up? Anything new and exciting that are going to be under the Alex's umbrella going forwards here?
Yeah, we have some funding that came our way, and it's truly, and I'm super pleased because it is funding that is dedicated for really making our addiction care more robust, and it kind of speaks to not just having specialized programs, but truly making every program capable of providing addiction care to our community members. So it will add more mental health clinicians, peer support, and nursing staff to engage with folks in those conversations. Kind of going back to not just leveraging, but creating windows of opportunities, creating a trusting relationship where we haven't really talked about peer support, but that is certainly another passion of mine where I think adding peer support to healthcare is incredibly powerful. I do see that in the hospitals more and more as well. And it is really bridging that disconnect that we as a healthcare system created for our community members where trust has been broken, and peer support workers having walked a path themselves, being able to walk beside our community members and clients, and act as almost conduit between the professional system and the people we are serving. And they can connect like no other, and they use their story to really give hope and suggest a different path. So we're able to add peer support workers, and we know looking at our data, especially since COVID, a majority of folks come in and disclose mental health and addiction issues, and they don't always show up in our addiction and mental health programming. They come to the doctor or they just talk to the nurse, and we really need to equip ourselves to be able to support that need and that support for our providers, our nurse practitioners, and our physicians, but across the board, because sometimes things get worse before they get better. I have great hopes for the future, but 2023 was the most difficult years in terms of losing community members to the those crises. And we need to do things differently and be innovative and offer care where it's needed in the most innovative ways, and offering care if you came for your broken ankle and we engaged in a conversation and you share with me that you're really bummed. You hurt your ankle because you kicked the wall so hard, because you lost your job, because perhaps you have been showing up under the influence at your work. I want to walk through this door and I want to engage and have that conversation about substance use if you're willing to go there with me. And I definitely want your ankle patched up and have you go for x-rays and all that. But I also want to discuss if you're open to that, discussing substance use and just giving you options, and especially for alcohol use disorder. And people are often surprised to learn that we lose way more people here in Calgary to the effects of alcohol. People die more overtly, for lack of a better term, and more dramatically and more swiftly of an opioid overdose. But we have way more Canadians die of the often long-term effects of alcohol use disorder. Just like my cherished client Gordon died of a massive heart attack, and we have lots of struggles with alcohol, and that it's so well socialized and accepted is not really helping if folks have seen the new drinking guidelines that came out, I believe it was last year or the year before. It's quite shocking what people that know a thing or two about alcohol are recommending to us in terms of a low risk intake. And I can tell you it's pretty much nothing. And we underappreciate the risk of alcohol, and we sometimes demonize or stigmatize more illicit substance use. But especially for alcohol use disorder, people don't know that there's treatment, there's medication for alcohol use disorder. So I might just give you some information, you showing up, sharing with me that you lost your job potentially because of problematic drinking, and I tell you, hey, there's actually help, and if that's something you're interested in, I tell you more about it. And if you're not, then I trust that you come back if when you do. So yeah, that's kind of up for us, that we're able to provide we started calling it the golden thread of mental health and addiction care, that no matter where you go, the thread of excellent care is just woven into the fabric of our services. That sounded really poetic. Anyways,
Save that one for later.
Yeah. So we receive funding to do that, and I'm really excited to be supporting and leading this work.
Well, Jennifer, thank you so much for sharing some more about the Alex and kind of what's going on behind the scenes. It's such a great organization. Sharing a little bit more about the stories, the people, the resilience. Final question for you: how do you keep yourself going? What's your number one mental or physical health and wellness tip?
I love to learn, and there is so much to learn how to do care better, especially in mental health and addiction. And I'm just driven by this notion that there is something we can do better to really make a difference into our community members' lives. And I do that by reading and by going to school and by talking to folks that are experts or lay people. Our clients are incredible sources of wisdom and should always be guiding our work. So I'm what keeps me going is thirsty for solutions and better care, and just kind of making up that there is something that we completely haven't explored yet. And I'm just that person that wants to inch, whether it's inch or mileage, doesn't really matter. I want to get as close to that as possible. And I know I have lots of like-minded people that are right there with me. So it's that knowledge there is something out there we don't even know about will really move the needle. So
the thirst for knowledge. I love that. Well, Jennifer Eyford, thank you so much for joining us today. Really appreciate it, and would love to have you on again sometime. Thank you so much.
Thank you so much, Dr. Jordan.